Hey guys, so today our topic is compression and contraction atelectasis. We'll go through the definition, causes, pathogenesis, clinical findings, questions, and review. Coming to the definition of compression atelectasis, it's basically the collapse of small airways and alveoli deep to the pleura that occurs when the air or fluid would in the pleural cavity is under increased pressure. So these are few key points that we need to remember. Collapse of small airways, alveoli, pleura, where there is air or fluid buildup which increases the pressure. So as you can see in the picture, this is the pleural effusion. Here there is fluid present in the pleural space. This is compression. So basically you just need to remember fluid in pleura cavity. Coming to the causes, we have pleural effusion. So pleural effusion is commonly known as fluid around the lungs. It is an abnormal accumulation of fluid in the space between the lungs and chest cavity, which often causes shortness of breath and chest pain. Then we have hemothorax. Now this is the accumulation of blood in the pleural space. Then we have pneumothorax, which is a collapsed lung caused by air leaking into the space between the lung and chest wall. Then we have tumors. Then we have diaphragmatic elevation. Now here ascites or pregnancy. So this is abnormal buildup of fluid in the abdominal peritoneal cavity, and it's most commonly 80% of the cases caused by severe liver disease or cirrhosis. Then we have pathogenesis. So there is fluid, air, or mass accumulation which increases the intrapleural pressure. And because of this, we see the lung has compressed and which causes the alveoli collapse. Now, the thing to remember over here is the mediastinum would shift, as we saw in the obstructive atelectasis. The mediastinum would shift towards the lung that is affected, whereas in the compressed, we see the mediastinum would shift away from the affected lung. Now this is an important point, that is why it is star marked over here. So the pathogenesis is basically the lungs would be compressed externally. Now we have the clinical findings. We find there is dyspnea, which is shortness of breath, decreased breath sounds, dullness seen in effusion, hyperresonance seen in pneumothorax. Then we have the trachea which diverts away, and we have reduced chest expansion. Coming to the questions, there are 3 questions that are mentioned over here. You can go through them and comment down the answers below. Now coming to the quick review, the cause of compression atelectasis is basically it's outside the lung. Therefore, it was mentioned it is compressed because of external thing. Then we have mediastinum. The mediastinum shifts away from the affected lung. An example would be pleural effusion. Coming to contraction atelectasis, it's basically collapse of the lung due to fibrosis that are present that will prevent lung expansion. The causes are pulmonary fibrosis. Here you can see in the picture, we can see irregular thickening of tissue between the alveoli. There is irregular abnormal air spaces, large areas of scarring, that is fibrosis that are present. Then there is old infection. We have the TB, that is tuberculosis. Then we have radiation fibrosis, which is seen in this picture. And we have chronic interstitial lung disease. These are the causes that can cause the contraction atelectasis. Then we have pathogenesis. This and the pathogenesis involves when there is chronic inflammation, it leads to fibrosis. Then we have fibrotic tissue contraction. Lung becomes stiff and non-compliant. Then we have it cannot expand properly, and there is persistent collapse, often which is irreversible. Then we find the clinical findings over here are there is progressive dyspnea, reduced lung expansion, fine crackles because of fibrosis, then no major mediastinal shift is seen, signs of chronic lung disease. Here again there are three questions that are mentioned. You can go through them and mention the answers in the comment box. And for the review, the cause of contraction atelectasis is basically fibrosis seen inside the lung. Mediastinum, there is minimal or slight forwardness or no shift. And reversibility, it is irreversible condition. Okay, so I have finished the atelectasis part, and this is all. You can, if you like the video, please hit like, and thank you for watching it. Thank you so much.